Welcome back. It's time for morning rounds this morning. Deep vein thrombosis awareness month is actually observed every March. This condition is serious and can sometimes lead to pulmonary embolism. Vascular surgeon Dr. Jennifer Ash with Christie Clinic joins us live over video chat with everything we need to know this morning. Good morning, Dr. Ash. How you doing?
Good morning. Thanks for having us.
Thanks so much for joining us this morning. So first and foremost, can you tell us, I know it's known as DVT, what is that?
So a DVT is a term used to describe a blood clot that occurs in a vein. Most commonly we hear about these in the legs, but they can happen anywhere within the venous system, and worst case scenario, they can break off and travel up to the torso and cause what's called a pulmonary embolus, which is a blood clot that lodges in the lungs.
And this actually causes quite a few deaths every year. Can you talk a little bit about what pulmonary embolism is and what are some of these risk factors that we should know about?
Sure, absolutely. So roughly 50,000 people or so die a year from pulmonary embolus. Fortunately, we're much better now than we were some time ago at preventing blood clots and therefore pulmonary embolus from occurring. And we know that certain groups of patients tend to be more at risk. For example, those folks who are a little bit overweight, more elderly patients well above their 65th birthday, sometimes people who've had a history of DVT in the past are at higher risk. Those folks who have a major surgery that they're undergoing or even a trauma that caused them to be immobilized for a long period of time. And of course, sometimes we hear about people getting these after long bouts of travel, so cross-country or international flights. A little bit higher risk in people who are pregnant and a little bit higher risk in people who've had a history of just clotting previously, such as a stroke.
Is that because for those people who maybe have traveled recently, is that because they're not walking around as much on those long distance traveled?
Yeah, exactly. So a lot of folks, I mean, less now, of course, with the coronavirus, but a lot of folks who do international travel or cross-country travel, you know, they're confined to a rather tight airline seat for many, many hours at a time. And so that can certainly lead to stagnant flow in the legs, which can cause a blood clot. Now, of course, we're seeing more patients travel long trips by car. And that can sometimes be the root cause of a DVT as well.
So would you suggest if you are obviously in a plane, you don't really have that much room to move around, got a little bit there, but if you are taking a cross-country road trip, would you suggest taking multiple stops and actually giving yourself a little bit of a break and taking a walk?
Absolutely. So generally I recommend to my patients that they wear at least a knee-high light compression if they're going to be in a car, on an airplane for a long time. And certainly if you're driving, it does help to make occasional stops, get out, walk a little bit. Of course, if you're confined in a car or airplane, you can also just do little heel pump sort of exercises to stimulate your calf muscles, which then kind of milks the blood out of the leg back up to the torso.
And doctor, what are some symptoms that people need to watch out for when it comes to this?
Sure. So the most common symptom that people experience to begin with after a surgery or a long car ride would be just kind of a general achiness, heaviness, or pain in one of the legs. This can often be accompanied by swelling, and sometimes the skin is red and the leg is warm. If folks have varicose veins that are near the surface of the leg, many times those will clot as well, and those become sort of lumpy, bumpy if you rub your fingers over them. And then if for some reason a blood clot does travel to the lungs, the most common symptoms we see are a rapid heart rate. We also see chest pain and sometimes shortness of breath.
And you mentioned those compression socks, doctor. Is that really the main way to prevent DVT?
It certainly is a help, and you know, anybody who's undergone a major surgery has probably had that experience in the hospital where they either put socks on your legs or sometimes they use those boots that squeeze your legs incrementally to keep the blood moving. But certainly it's very important that people stay active, especially during times when they're immobile. So post-operatively after surgery or during times of travel. Getting up and moving is really critical.
Of course, doctor, we mentioned at the beginning of this, we talked a lot about that pulmonary embolism issue along with the DVT. So that's a pretty scary diagnosis. Is there any treatment for this?
Oh, absolutely. So if a patient does have a DVT, the mainstay of treatment tends to be a blood thinner, which now we have several at our disposal. Some are injectable, some are in pill form. So that's very important. Of course, wearing those compression socks can help with pain and swelling if you do have a blood clot in the legs. And if for some reason a patient can't go on blood thinners or comply with some of these other measures, say for instance in a major surgery on the leg that really immobilizes them, we always have the option, if needed, of placing what's called an IVC filter. And that's really just kind of a miniature strainer of sorts. It sits in a big vein in your stomach and it protects blood clots from breaking loose and going to your lungs. It in no way prevents a blood clot in the legs, and it also doesn't dissolve a blood clot, but it does protect them from breaking off and heading up to the heart and lungs.
All right, Dr. Ash, thanks so much for your time this morning. Very informative.
Thank you. I appreciate you asking us.
Have a great day.
Yep. Bye-bye.
Bye. Amelia's got your forecast right after this. We'll be right back.